Call this meeting to order. We'll start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of a discussion, consideration, and action on the following items. Minutes of the Finance Committee meeting on November 18th, 2013. Minutes of the monthly trustee meeting on November 19th, 2013. Minutes of the Special Finance Committee meeting on December 2nd, 2013. Minutes of the Special Trustee meeting on December 12th, 2013. Minutes of the Special Finance Committee meeting on December 30th, 2013. And a check report November 13th, 2013 through January 9th, 2014.
I move that we approve the consent agenda as listed. The consent agenda as listed in the agenda.
A second.
We have a motion by Dr. Kinsey and a second by Darlene Sanderson to approve the consent agenda. Roll call vote, please.
Klein?
Yes.
Jasper?
Yes.
Kinsey?
Yes.
Knox?
Yes.
Sanderson?
Yes.
Next is the CEO's report. Candace?
I'd like to introduce Bridget Cosby. Bridget took Kyle's place, so Bridget will be attending our monthly meetings and will be our new contact person through St. Anthony's. So we're glad to have Bridget. I've known Bridget since I've been in this position. She had been at Holdenville and Pauls Valley and now is employed through St. Anthony's. So we want to welcome you, Bridget.
Thank you very much.
Let's go around the room real quick so that you can kind of become accustomed to who.
Terry Klein.
Klein? Okay.
Rick Cunningham, the board attorney, not a board member.
Okay.
Steve Knox.
Liz Kinsey.
Darlene Sanderson.
Jason Gansford.
And then
Jane Gaskell.
she's our administrator at the nursing home.
Oh, okay. Great. I'm Heather Vaughn, Controller and Director of Patient Care.
Okay. Very good. Okay.
That's Kelly Beck.
And that's good.
And the camera is rolling, and there'll be a live feed tonight. You can watch yourself.
Yeah. Some control.
All right. So you would think, not having a meeting for a couple months, we'd have a ton of stuff to go over. But really, it's kind of been uneventful for the last couple of months. The hospice staff has really been working on marketing their services, and I think it has picked up a little bit for them. They had been pretty slow, but they've picked up just a few here lately. Pat Knight has been working with the nursing home on their swing bed stays and reimbursement to try to improve that. Dr. Mullins, back in November, the end of November, had done a talk for the public at the Tech Center, Let's Talk Cardiology, and she had a good turnout. She had about 29 people attend that. Volunteers still working away for the month of November. They had 209 hours. Our HCAP scores for October were excellent at 100%. They continue to do follow-up phone calls to search for areas of improvement in patient care that are needed. Physical therapy has shown an increase in commercial insurance for the month of December. Lindsay Pruitt, our new PA, did start seeing patients last week, and so we're tickled to have her. I know Dr. Kinsey's glad to have Lindsay here. And Dr. Kinsey, thank you. You've worked at a frenzied pace for several months now and without complaint, and I appreciate all that you've done. She's worked very hard and needs a big pat on the back for that. The Physicians Clinic has also started with a new scheduling and billing system that they started using January 1st. This is through our billing company for the clinic. It was through them at no cost to us. It was the system that they were currently using. We were actually on the old system, and so we moved over to the new system January 1. Lynn Heasley was awarded a volunteer award through OHA. Kelly recently recognized him in the paper for that. I don't know what we'd do without Lynn. Lynn did not retire. He just came to work for us for free. So he and Dr. Brown and Carol are familiar, regular faces around here. And I'm telling you, we literally would have to hire people to replace them if any of those three were not volunteering for them. So we do appreciate their service. The lab got a new coagulation analyzer and ACE Elite. They're very excited to have that. Cimarron, the liability company that we had for years, on January 27th, they will pay the reinsurance premium to Plyco, discharge any non-insurance liabilities, surrender the company's license to the insurance department, and then will be available to release the paid-in capital. As soon as the 2013 financial statements are finished, towards the end of February, the company will release the excess surplus. We had a phone conference, I believe, back in December, and they are going to do that based on paid-in premiums. So that makes me feel a little bit better, since we were paying extremely high premiums. So hopefully we'll get some of that back.
Have any idea
Which is good news.
roughly how much?
I don't. We elected as members not to review that information, just so that it was done fairly by the paid-in premiums. That's what we elected to do.
Yeah.
So
We're outside of Guthrie. We were the largest
yeah,
premium.
we were second highest paid-in premiums. So that does make me feel a little bit better about it. As you know, the EHR Phase 1 money was received November 25th. Like I said, not much. That's really all I have for my report. I do have we need to do that. I'm sorry.
Does anybody else have any other questions for Candace in regards to her written report?
I move we accept that report as presented.
I'll second it.
We have a motion by Steve Knox, a second by Dr. Kinsey, to approve the Share Medical Center written report to include hospital, hospice, and convalescent home quality measures, HCAPS core measures for January 21st, 2013. Roll call vote, please.
Klein,
Yes.
Jasper,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
The next item is the approval or disapproval of the Share Medical Center nursing policies and procedures.
And I have those here. These have been reviewed. They have been approved through medical staff as well. If you'll remember back, I don't know, 2 or 3 months ago, we started reviewing the rules and regulations, and all departments have been also going through their policies and procedures to make sure things are up to date, and I'm bringing those to you today for approval.
I move we accept the Share Medical Center nursing policies and procedures as presented.
And I'll second it.
We have a motion by Steve Knox, a second by Dr. Kinsey, to approve the Share Medical Center nursing policies and procedures. Roll call vote, please.
Klein,
Yes.
Jasper,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
Next item is the approval or disapproval of the Share Medical Center pharmacy policies and procedures.
Same thing. And Zach, our consultant pharmacist, has reviewed them as well.
I move we approve the Share Medical Center pharmacy policies and procedures.
Second.
We have a motion by Darlene Sanderson, a second by Steve Knox, to approve the Share Medical Center pharmacy policies and procedures. Roll call vote, please.
Klein,
Yes.
Bassett,
Yes.
Kennedy,
Yes.
Knox,
Yes.
Sanderson.
Yes.
Okay.
Mm-hmm.
We got a doctor in the house.
Yes, we do.
The next item is the approval or disapproval of the Shared Medical Center ER policies and procedures.
Dr. Culvert has reviewed these. Same thing.
Okay.
I move that we approve the ER policies and procedures.
Second. We have a motion by Dr. Kinsey, a second by Terry Klein, to approve the Shared Medical Center ER policies and procedures. Roll call vote, please.
Klein,
Yes.
Bassett,
Yes.
Kennedy,
Yes.
Knox,
Yes.
Sanderson.
Yes.
Candace, do you have anything else?
No. Thank you.
Okay. Next item is the CFO's report. Albert?
Okay. I'll kind of cover November and December as far as statistics together, but for the month of December, we averaged 1.55 patients in the hospital. Prior month, or November's, we basically averaged 2.33, and last year was 1.80 in December. Swing bed, hopefully Pat can get some additional swing bed patients for us, but our census in December was 0.62. November was 0.27, and last year was 0.46. Nursing home did pick up a little bit. I know they had a lot of deaths the last several months of the year, but for December they averaged 52.68 daily census. November was 49.6, and last year was 57.25. Basically ER, surgeries, lab, x-ray, they're all down from previous years. And I did talk to the radiology supervisor, and she thought that MRIs and CTs was down about 165 procedures from last year, but with us starting the upfront collections, them being higher dollar procedures, she felt that some patients was not getting the test done because of not having to pay up front, which we probably wouldn't have got paid anyways if they would have had the test done. So it's better all, not necessarily better for the patient, but PT and hospice are up, and in the clinics, basically all the clinics are up from last year's numbers. November financials, we did have a operating profit of $1,405,218. Of that, $1,482,348 was the EHR payment. So without that, we would have had an operating loss in November. The hospital had a $1.4 million profit. Once again, that EHR money was in there. Nursing home had a $412 loss for the month, and then the homestead had a $5,404 profit for the month of November. December operating loss for the combined entity of $51,410. Year to date, we still do have a profit, basically because of the EHR, $1,215,260 compared to last year of $23,052 profit. Hospital for the month of December had a $31,278 loss. Nursing home, $10,436 loss. And the homestead for November actually showed a little bit of a loss, but some of their payments got posted in that we received that were for December got posted in November, so but they had a loss of like $9,900. We did get the final check from the city for the $6,100. We got that in November, so they did catch up on that. We did have a call today with Barry Kurtz Dobson. Candace and I talked to Chris Murphy on the audit because we had not heard anything since, well, I guess basically I'll say since he was here in November. He did apologize that basically they had dropped the ball. There were some things that they didn't think they had. They have a new website where I downloaded a lot of the information as far as the work papers that they needed, and they ended up finding all the work papers in there that they thought they didn't have. So he basically has pulled the two guys that were working off of other engagements, and hopefully maybe what end of next week possibly has some tentative numbers and stuff. So that's kind of where we're at with that. And I think I've talked about Coventry. We're still battling Coventry, trying to get them to pay correctly. We've probably gotten at least 9 remittance advices that they have sent us weekly, basically, where they're wanting money back and stuff. But we've posted one of them, but it's the same remittance advice for basically 2 months.
And every time they send that to us, the patients get an EOB?
I think it's...
That I don't know
Are
if
they
they did
getting-
on that repetitive one, but
Okay.
I know
Just
they
curious.
received one.
But anytime they make a change, because I think Heather and several of them have gotten calls, and maybe Candace has too, if they make a change that they reprocess it from Coventry, they're getting an EOB saying that we've reprocessed this. I mean, we're not sending any bills out until we get, completely everything cleaned up, and hopefully Coventry will pick up what the patient, because the patient could end up owing more with the correct contractor and paying on, because it's a higher percentage. If it went to the deductible, it'd be a higher amount goes to the deductible. So,
But remember, this was a Coventry issue. They paid us. Coventry paid on the wrong contract. And so all of that had to be reprocessed. It's been a mess.
I think that's all unless there's questions.
I've got a question, Albert, on the hospital income statement for November.
Okay.
Other operating revenue, what did you say that was?
That's basically the EHR payment of $1,480,000.
Can we get a payment like that every month?
Yeah, it'd be good.
It's twice a year.
And we did catch up basically on a lot of payables. I think all the local vendors, basically we caught up on those, and some of them aren't completely caught up. I mean, as far as local, we're completely caught up, but others we got closer to being current on those and stuff. With that money.
On Dr. Kinsey's clinic, since she's here, we'll talk in front of her. Why is there deductions from revenue in excess of revenue?
In November, I don't think we had gotten everything, and I didn't reverse something out. December's probably a better month to look at, because it is completely current with our billing company.
Oh, yeah.
Yeah, November, like I said, we didn't get the information from a billing company, so I made some estimates, and I think we can back something out from October possibly, but
So the year-to-date actual on December, that should be pretty accurate for the year?
yes.
Okay. Thank you.
Any other questions for Albert? If not, Albert, thank you. The next item is Medical Staff Executive Committee. Chief of Staff, Dr. Elizabeth Kinsey.
Okay, the medical staff met and recommended reappointment of 2 staff members. So I move that we reappoint to courtesy staff Dr. Ricky Reeves, MD, for pathology.
Second.
We have a motion by Dr. Kinsey, A second by Steve Knox to reappoint to courtesy staff Dr. Ricky Reeves, MD, pathology. Roll call vote, please.
Klein,
Yes.
Gasser,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
Okay, I also move that we reappoint to Allied Health staff Brett Purvis, physician's assistant.
A second.
We have a motion by Dr. Kinsey, a second by Darlene Sanderson to reappoint to Allied Health staff Brett Purvis, PAC, physician's
Over there.
assistant. Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson.
Yes.
All right. Anything else, Dr. Kinsey?
Lindsay is doing an awesome job. She just jumped in, started seeing patients as soon as her credentialing and stuff got straightened out. She's been cranking out gorgeous charts that are daily. I mean, just really fine work. It's really nice. And the wound care clinic kind of waxes and wanes. We fix some things, and the number of patients we have drops down, but then we get a whole bunch more. I've been really pleased. We've been getting a lot of referrals from Cherokee.
Oh,
So
okay.
it's nice, and those patients are very thrilled to be able to just drive over here.
And we are going to do some advertising here pretty quick, I think.
but,
Jill and Kelly are working on that.
But people are happy, and it's nice to get some referrals. So
Very good. Well, thank you for all you do. Appreciate it. Next, the EHR report.
They're working on 6.07, which I think are go lives toward the end of February on that and stuff. So that's basically what we've been concentrating on for the most part right now.
Okay. Anything else? Okay. Thank you. Next is the shared convalescent home report.
Good evening. It seems like a long time since we've been here. It does. Lots of cold weather and sick people in the meantime, but we managed to pull through. We did have something wonderful happen. We have talked about this for a couple of years, but I had Mr. Rose from Rose Plumbing come up and with a fireplace, and we did use it to our benefit, And it hasn't been on probably for 10 years, but it was wonderful to have it on, and it looked really nice for Christmas. We were glad about that. Plus, it really did help when it was cold and our heating just couldn't keep up, so that was nice. Christmas, the staff really outdid themselves with that outdoor lighting and the food and the preparations for the Christmas dinner. Thanksgiving's usually our big meal. Families come, but not this year. But Christmas, we were overran with every nook and cranny was full of people. Some patients had up to 8 to 10 guests for dinner, so it was really fun.
Wow.
And it's that time of year again that college students start all revolving and changing. We are fortunate that we have Northwestern students. A lot of them in the nursing program. That's a requirement these days, so we're very fortunate. However, on our compare sites, it looks bad that we have all this revolving nurse aides, but really it's good if you know the real story, because they are being educated and trained and learning. So we're glad that they can go on and be in their profession. Let's see, we're sad this week, Rhonda Pinkston, our dietary manager, this will be her last week. She will be going out to BJCC. So Kelly's sharing his person with us. Any questions can you think of? Don't ask me why I don't have any more money. Sam didn't bring me any. That's all.
Thank you. Appreciate it. Next is the homestead report.
We have 33 rooms rented at the end of December. We've got another agreement almost signed. It's virtually signed. They've chosen their room and they told me when they're moving in March 1st. And then another couple that are still kind of hanging out there. It takes people a little while to make this decision to leave home and move into the apartment. So we're patient with them. But families really like the homestead. Parents might not like the homestead as much as home, but their kids tend to really want their family members to come out to the homestead. We've been having quite a bit of activity. We had a very big turnout for our annual Christmas open house, and I think if you participated, you may have had to walk a couple blocks just to get to the front door. There were cars lined up all the way to the end of the hospital and down the road, so it was a very good turnout there. We hosted a few other meetings with the Red Hat Society, the Library Board. Retired Teachers Association was with us a couple weeks ago with Jeff Hickman, and so that was nice to have them there. I try to encourage people, if they have groups, especially groups of retirees that are needing meeting places, that we would love to have them out to our facility for a meeting, and hopefully they get a chance to maybe see the homestead for the first time, and it might be something that they think would work for them on down the road or even currently. We're staying busy. Like I said, Terry Curtis, as Jane mentioned, Rhonda's leaving. Terry Curtis has been the dietary manager for the homestead, and she will be assuming at least an interim position as the manager for both dietary departments, and we're excited about that. We're hoping for as smooth a transition as possible, and Rhonda and Terry are working together this week to, I guess, hopefully make sure that happens. Any questions?
There's no questions. Kelly, thank you for your homestead report. We'll lead you right into your SMC Foundation report.
The Foundation Board met on January 9th. We've gone to a quarterly meeting schedule, so once a quarter I'll have a report for you. The second quarter we had total of 552 gifts, totaling roughly $35,000. We just finished sending out our annual statements, and so you should be getting those in the mail if you haven't already, regarding your 2013 donations. We've had several different types of donations for restricted purposes, a lot for the nursing home, the homestead, equipment here at the hospital. We did have one room dedication, which I'm working with the donor as far as when we're going to do a public acknowledgement on that. But that's a $10,000 donation that they designated for equipment purchases to dedicate a room upstairs here at the hospital. Any questions?
Does anybody have any other questions for Kelly? If not, Kelly, thank you for wearing your many hats. Next is the St. Anthony's report. Bridget.
Oh my.
Welcome.
Thank you. I'm not sure what kind of report that Kyle
It's
would
usually about a
actually
2 or
get.
3 hour dissertation.
Was
It's too
it? I'm
long,
sure it
so
was
long.
very entertaining.
We always fell asleep halfway through.
He just usually kind of updated us on what's kind of been going on, or kind of the things that we've been working on, maybe.
Okay. Well, I was going to say, it'll be a while probably before I can actually tell you kind of what's going on at St. Anthony's as a whole. I have been employed by them for the past 2 years, but I have been down at Pauls Valley with the management agreement, functioning in the CEO role. So I didn't get a lot of time to spend up at St. Anthony's to get acclimated to everything. So I really, in the last 30, 60 days, really I've been ingrained in kind of what's going on in the organization and trying to learn. So, but obviously my primary goal is to work with the affiliate hospitals and try to use our resources the best that we can to help y'all develop services, do marketing, just help with anything. Candace and I talked a little bit about survey readiness today. Those are just things that, sometimes you forget that are out there, but they could show up at any time for survey. So I told her I had some tools that we could work with and see if there's any opportunities there to prepare for the auditors to come from the state. I don't know if y'all are aware or not, but they're really hitting the state of Oklahoma really hard right now. And the small rural hospitals, unfortunately, are the ones that are suffering the most. They've shut down several surgery areas for infection control purposes, mainly because a lot of them are still structured kind of in the old format. And when they observe, they kind of don't like the way things maneuver, because it really is different than when it was, 20, 30, 40 years ago in some of the facilities. So it's been kind of interesting to work with them and see kind of what their thought processes are. And that's another thing. I've been trying to work with the state to get some educational opportunities put together so that they can come educate all of us of the things that they're looking for, the things that we need to be compliant with, instead of coming and being punitive with it. And it would be a much better partnership in that direction. So we're hoping that they'll work with some of the other organizations and with OHA to kind of develop some of those opportunities to kind of help with that, because those are just never fun situations to be in. So we'll continue. I'll be here each month, hopefully early enough that Candace and I can always kind of visit, but she has my number and we can certainly talk each month. But we're excited about continuing to develop the affiliate network, and as I learn how to navigate the system better, then I'll be a better resource. But I'm certainly in those beginning phases.
She's a great resource as well because she has a CFO background and has worked in that role, so she will be a huge benefit to us as a resource in the business office as well.
So I'll be willing to help in any avenue that people need help in. So, but I'm hoping we can really collaborate as an affiliate network and not reinvent the wheel on a lot of different things, and really get people engaged in opportunities so that we can kind of dilute the cost for lots of educational opportunities and other things that are out there that we've got to stay abreast on. So if anybody has any questions of me, I'll be happy to answer them.
It was a pretty good first report.
Thank you.
Thank you. Not
So
quite long enough.
I was going to say, I won't be quite as entertaining as Kyle, but
pictures of your kids, your pregnant wife.
oh my. Yeah. That's too funny.
Well, Bridget, thank you.
Thank you.
We appreciate your willingness to be here, and also St. Anthony's continued support. We appreciate that very much. The next item is the City Council report, but Scott Brown is not here, so I'm assuming we do not have one. They did send it with the legal counsel.
Well, it meets in 25 minutes.
Oh, okay, very good.
It's in Missouri.
I do not have anything extra to report. And are there any other items of new business? If not, folks, we are adjourned. Thank you all for being here.
Wow.